Does anything particularly seem to trigger it?
I thought maybe Pinot Grigio would be a trigger, because every time I seemed to drink that, I would get a headache afterwards.
Can you put your hands behind your back as though you're doing your bra?
I can't put my bra that way.
That gun,
Yeah.
will it increase my CO2 emission?
No.
I buy some, what they call Dr. Chicken nuggets. I eat, like, say, 30 of them in one go.
That's quite a lot.
It's making me anxious. I'm a nervous wreck. I just can't stay there.
Why not?
I feel vulnerable. The house has been broken into before.
Right, okay.
I started having a panic attack and thought, oh my God, maybe I've got like ovarian cancer. Because it really hurt.
I mean, that's the most terrible bruising I've ever seen.
Well, I might have knocked it because I don't notice, you see, because I'm so used to bruising.
Good morning, Nana speaking. How can I help?
Hello, hi. And what's brought you in today?
I've got a bit of a sore throat. I've had flu for about 10 days. And I'm going on holiday tomorrow. So the last time I went on holiday and then I had a niggle. It turned out to be something really big. So I just wanted to get it checked out.
Okay. It certainly sounds like laryngitis, that loss of voice.
Yeah, I've been able to talk a bit more today, but I completely lost my voice since Saturday.
Okay.
It really just doesn't feel like it's getting better.
Unfortunately, so things like the laryngitis is typically more with a sort of loss of voice. It tends to be caused by viral things as opposed to bacterial, and not something that gets better with any medication. But we'll certainly have a look and see whether or not we should go down the route of anything.
No, it's fine. I just wanted to check it out.
Okay. 36.8, so that's nice and normal. If you open up nice and wide, it's not terribly exciting at the back. So the tonsils aren't huge. There's not loads of pus or anything along those lines. And if you took your head forwards, where are you going? Are you going somewhere nice?
I'm going to Lisbon for a hen weekend.
Okay.
Yeah.
Hen weekend like this.
I organised it, otherwise I wouldn't go.
Not the best combination, unfortunately. Stand up and let's have a listen on your back. If you is this a dress or?
Yeah, it's a dress.
Well, we can probably listen from the top if you slip your cardi off. Okay, perfect.
Yeah.
And some breaths in and out through the mouth. Yeah, chest is clear as a bell. So what happened last time? What were you worried about from last time? Where
I just had a sore tooth, and by the time I got there, it turned into like a wisdom tooth. And I just went, oh, nothing was open because it was Easter.
Yeah.
I just spent the whole time in agony.
Yeah, you're doing exactly the right thing at the moment, which is resting the voice and not shouting at anybody, limiting your alcohol intake in this hen weekend.
Can you say limiting?
Well,
realistically.
Do as you feel is right.
Okay. Is there anything else I can do?
Things, sort of sometimes, from a pain point of view, gargling aspirin is the best option.
Okay.
But other than that, there's nothing. It's just resting the voice and time. If you go to either NHS Choices or patient.co.uk websites, there's loads of advice on there. And if you just put in laryngitis, which is what this is, and it is just time. It's really the key.
With the flu that I've had.
Probably just incidental. Your immune system was probably knocked with the flu, and then you developed this infection.
All right, thank you very much.
Yeah, enjoy this hen weekend.
I'm going to make some signs.
Well, you need, sort of a standard set of signs and go from there. Take care. Take care. Bye then.
What's your date of birth, please? Oh, happy birthday!
Come and have a seat. I'm Dr. Beecraft. Thanks. Sorry to keep you waiting.
Don't worry at all.
Right, what are we up to this morning?
Okay, so basically, I suffer from migraines.
Okay.
And I have been since I was probably about sort of 16, but very, very rarely.
Okay.
And just recently, I get them all the time.
Okay.
And there's not a point where I pretty much don't have one. Like last night, I went to sleep and woke up at like 2 hours later, and I had one. I was just like, and I've tried everything that I can possibly get just over the counter. But nothing just seems to work anymore, and I feel it's affecting like my work.
Okay.
And I've just started an internship, and I've been off now because obviously it affects my vision. It makes me feel sick. I get them like over my eyes, and they're like a throbbing sort of sensation, and they're just getting really bad and really frequent.
So how long has it been getting worse for?
Probably about the last 3-4 months.
And do you get some kind of visual change with it as well?
My vision doesn't go, but it does become quite blurred and light. It's really like, I'm literally like looking at my computer screen like dimming it down.
Okay. And will you be sick at all with it?
I have done in the past.
And how long does it tend to last for?
Good 2 days, if not 3 sometimes.
Yeah. Does anything particularly seem to trigger it?
I thought maybe Pinot Grigio would be a trigger, because every time I seemed to drink that, I would get a headache afterwards. Not that I was like drinking lots of it, like a hangover, but even just a glass. So I've cut that out completely, and I don't drink that anymore. I was watching a documentary, and apparently there was a young girl who went to the doctors about migraine, and it turned out like they were like, oh, it's fine, like blah, blah, blah. And it turned out that she had a tumour and she actually died from it.
When I talked through Abby's symptoms with her, the nature of the headaches that she was getting didn't sound anything like a cancer-related headache. The symptoms were completely different and really did just fit with a migraine. Statistics show that everybody has about a 1 in 2 chance of developing a form of cancer at some point in their life. And for that reason, there's huge amounts of attention brought to that in the media. People will have read stuff and be more aware of stuff, which is a good thing, but actually may not always have the right diagnosis. So what I want to do is have a little look at the back of your eyes. I'm just going to turn the light out.
Yeah.
Okay, sorry, it's not very nice. Fine, that all looks nice and normal. So what I would like to do is try you with something slightly different. What I would suggest is I'm going to give you a medication that as soon as you get that feeling that it's coming on, that you take one then. And what I'd like you to do is keep a headache diary for me. So to make a little track of when you're getting them, out of 10, how bad it is compared with normal.
Thank you so much for your help.
No problem. Let's hope it helps.
Yeah, thank you so much.
Okay. All right, have a good day.
You.
Bye.
Bye.
So come in tomorrow at 12 and then I'll help you with your registration, okay?
Hello.
Dr. Shah, hello.
How are you?
Well, about 5 weeks ago, I was staying with my daughter down in Somerset. I got sunburned on my forehead. Well, it's now spread all over my face and my arms. The skin.
Quite dramatic, isn't it?
Yes.
Much, much worse than that. You must take off your jacket. I'm going to fill you in as to what occurred.
So 5 weeks ago it started?
That was the start of it, yes.
But this terrible pain that he's had on the shoulder. Now you'll have to just look at this bruising.
Oh, wow.
So tell me what happened.
Well, I was on a mountain bike and I fell sideways, put my hand out, and I still can't really bend it.
I slipped backwards as I was getting in the shower, elbows down, and smashed the decorative tiles.
Is it bending this way?
I don't think it's like broken, I think it's just like really sore, I guess, and then my head hurts a little bit.
And it wasn't that anything felt like it popped out or popped
No,
back
no
again?
popping. It was definitely a rip of some description.
Okay.
Hello, good afternoon. And come in, take a seat. And Miss Rita, what's brought you in today?
My arm, which I got a cricket ball on the 12th of July.
Okay.
So we only started up here, and then on Saturday it was down to there, and today it's gone from there to there.
Okay.
So I'm starting to get worried, thinking, what is it? What have I done?
You're using the arm fine then?
Yeah, I'm using it. Like,
and you managed to ride your scooter here?
Left-handed on the scooter.
Using the right arm at all on that, or?
Sometimes it was, sometimes it wasn't, because it's pain in there.
There's pain in and around this area here.
Yeah.
And if we just have a look at the elbow, it goes straight. That's good.
That up to there, it's hurting.
It's hurting in here.
Yeah.
Yeah. And the cricket ball hit you straight on here, did it?
I don't know where it hit me. All I know, I caught it, and that was the main thing.
Yeah. So you've got the catch.
Yeah.
Okay, fantastic. Is this causing any problems around here? No. Around the elbow? No. Okay. So I'm happy with everything bone-wise in here. What happens is when you've been struck by this ball around the muscle here, there's been a load of bleeding in and around the muscle.
Yeah.
Some of that blood's quite deep in the tissue.
Yeah.
And blood, even when we're getting a bruise, it's still fluid in the skin. It's still liquid.
Yeah.
And so what's happening, every night you go to sleep, that blood's, moving backwards in the skin and just coming out. And then you stand up all day, and then the blood slowly comes down in this direction. And so essentially the bruise, which was all in here, has just ended up around here. And the fact that you're using the arm fine, I wouldn't do anything else. And it will settle down over the next couple of weeks. But nothing else we need to do at the moment.
Okay.
You okay?
As I said, that's what I was main concern, just get it
What's it
out.
getting up to?
Yeah.
Exactly. Well, you can be relaxed.
Cheers.
Okay, take care. Have a good evening.
I mean, that's the most terrible bruising I've ever seen.
And no other reason?
No. I don't remember.
No falling,
I mean,
no injury,
I
no
occasionally
knocking.
bang myself and don't notice, but I'm used to the fact that I bruise very easily.
Yes. A blood vessel must have been injured at some point somewhere. And that obviously normally happens from knocking it.
Right. Well, I might have knocked it because I don't notice, you see, because I'm so used to bruising that if I just bang against
No, but it's never been like that before.
No, it hasn't.
It would have to be quite a big knock. So
Yeah,
if
you
it's
would have
not
noticed
that, then it could have been one of your superficial veins here might have by itself just popped.
Right.
And then just in your case, it's just made a much bigger bleed come up here. So I think that's probably the more likely thing, because you would have felt the pain of knocking it to cause this.
But that's the shoulder. But this is, at the moment, the worst thing is...
The redness. Yeah, that skin is just irritated so badly.
Yes.
Is that psoriasis?
No, it's not. This is the sun. This is a overreaction.
Really?
It's a photosensitivity reaction.
Really? Are you sure?
It can be because of different things. So it can be because the skin is made sensitive by something else.
Well, I do have a very sensitive skin, I know that.
So it's definitely not psoriasis?
No. Psoriasis comes in patches. The thing we want to turn this reaction off is a steroid cream. And in your case, we might need two. One for the arms.
Yes.
Anything below your neck is going to be a stronger one, and on your scalp and your face will be a milder one.
Right.
And what about the swelling on his hands?
This is linked in with this sun reaction rash.
I'm absolutely
It can be
amazed
dramatic.
at that.
It can be dramatic.
So really, he must never, ever go in the sun.
Ever again.
What you must do is, if you go in the sun, you must wear factor 50 on the areas that are exposed to
So
sun.
no more trips to
and a hat.
Ibiza.
No more trips to Ibiza.
Thank you for being so thorough.
No problem.
Anyway, lovely to see you, Dr. Sharp.
Thank you very much indeed.
Bye-bye. See you.
My belly's just bloating. Should I just stop eating wheat? No, I'm gonna bring in my what's that tea?
Green tea?
Yeah.
I don't really know what's wrong with me, but essentially, I live quite a healthy lifestyle, like go to the gym like 4 times a week, eat really healthily, like I don't eat any overly like refined carbohydrates or anything like that. Super healthy. However, in the past month recently, every single time I eat, it literally looks a little bit like I'm 3 months pregnant. Okay. Every single time. Even if I'm only having like a bowl of soup, just blows straight up and it feels really tender.
Okay.
And it's getting to the point it's just so uncomfortable. And at night, like I literally cannot sleep because it hurts so much.
Yeah. And do you get any kind of tummy cramps at all?
Yes. So, okay, accidentally had pasta last week. And literally I was sat there at work and I just couldn't do anything. You know when you're just all cramped up? It just really, really hurt.
And what about your bowels? Regular?
Yeah.
Not hard, not too
No,
soft?
like clockwork.
Okay. Is your weight stable? Or are you losing weight?
So I
without
think my
trying?
weight's stable, but when I saw my parents last weekend, my mum kept telling me how fat I looked. But I don't know if that was only because I was so bloated.
Oh, okay. Is anything run in the family at all? Any bowel problems? Celiac disease?
So my mum's got IBS.
Okay.
This is my biggest concern because I feel like it's being passed down now. Apart from that, no. My grandma's diabetic and I think that's it.
Okay, fine. Can I just examine your tummy? You have a lie down on there. Are you okay just to lift that up?
So that's where it hurts there.
Saw there.
Yeah.
Okay. And here.
No, not so much there. It's more at the sides there.
Fine. A little bit tender here, isn't it?
Yeah.
I'll let you come down. Would you eat some sort of wheat every day? So some sort of bread, pasta, biscuits?
No, it's not too much wheat, but that's only because I've consciously cut it out in the past month.
I don't think there's anything serious going on.
Good.
So that's good.
So I started having a panic attack and thought, oh my God, maybe I've got like ovarian cancer.
Oh,
because it really hurt.
I think your symptoms, a little bit like irritable bowel, what you're
Yeah.
describing. Often people with irritable bowel tend to have some sort of bowel upset, so
Yeah.
either diarrhea or constipation. You don't tend to have that.
No, no.
So it's more kind of just the bloating and
Yeah.
things. So we'd always just suggest some blood tests, and that's really, we're doing those blood tests to make sure that you don't have anything more sinister going on.
Okay, then, yeah.
Okay. The other thing is that we're finding that certain foods are particularly bad for bloating.
As I
and
said,
sometimes
so-
it's very healthy food.
Yeah.
So people come and say, I eat a healthy lifestyle.
Yeah, that's
but it's,
exactly what I was confused.
You know,
So
things that can cause bloating are apples and pears and artichokes and beetroot.
absolutely loads of those.
I'm not quite sure why there seems to be an increase in people complaining of food intolerances. For some patients, avoiding certain foods can improve bloating. Limiting fruit juice to 1 glass per day. Also avoiding some foods that produce gas, such as Brussels sprouts, broccoli, sweeteners, cabbage. Some people find that lactose, which is mainly found in dairy products, can also cause bloating.
That's perfect.
Which
Thank
I
you so
think.
much. Really appreciate it. I just hope it gets better.
Yeah, it should do. It does
Keep
tend
looking
to
like
be
5 months pregnant everywhere I go because I'm so little as well. It just looks absolutely
yeah.
ridiculous. That's great. Thank you
All
so
right,
much.
pleasure.
Thank you.
Okay.
Hello, could you please give the surgery a call regarding your appointment this evening and speak to reception?
I don't speak to help.
I'm fine. What can I do?
asking that, should I?
What can I do for you?
I'm actually need a favour. I've recently swapped into a ground floor flat.
Yeah.
And you know I've been suffering from depression and the noise upstairs is horrendous. So I've been trying to get housing to move me to a different property because they've got creaking floorboards, I don't sleep. I'm lucky if I'm getting like 2 or 3 hours of sleep a night and I'm jumping up in the middle of the night with the noise because they're dropping stuff on the floor. Housing said the only way that I could possibly get a move quicker is if I get a medical note.
And have you tried earplugs?
Yes.
And they don't help?
No.
Why not?
I feel a bit vulnerable having those in, and I don't see why I should walk around my house with earplugs on all the time.
Okay, fair enough. There are GPs who really find this is very frustrating because people are coming in, they've been pushed to see their GP for a letter that's not primarily a medical issue, and it's just a way of whoever it is who told them to go and see the GP to get them out of the room.
I mean, the noise is absolutely horrendous. They've got no carpet, and the floorboard, it's a very old house. It's constantly creaking, and the people that live there are on shift work.
It actually saved me time to do it there and then, and I did have the time because I wasn't running late. It was quite appropriate for her because she has had problems with depression and anxiety, and it was obvious this was really upsetting her and that she needed the backup of a letter, and she'd be really distressed if she didn't get it.
It's making me anxious. I'm a nervous wreck because every time things drop on the floor, I'm jumping up in the middle of the night. I just can't stay there. And, you know, a lot of times I've been staying at friends' houses because I can't stand it.
So are you saying actually, apart from anything else, you're worried you wouldn't want to use earplugs because you would...
Well, I feel vulnerable. The house has been broken into before.
Right, okay. It's night time, really.
It's actually between 12 o'clock and 5 in the morning. And I'm a carer now for a friend who's got Alzheimer's, so it's quite difficult for me. I'm also considering going to the MP as well to see if they can move me a bit quicker.
If you want to speed up the process, I'd go to your local counsellor. I think that probably they are more likely to be helpful with housing.
Yeah, that's brilliant. Oh, thank you so much.
Okay.
Thank you. Hopefully it will resolve everything and I'll feel a lot better. Thank you for your help.
Okay, bye.
So my next appointment with the doctor is Friday. Do you feel able to wait till then?
OK, so I've booked you in 4:30 with Dr Laird.
Right then. We had spoken last time about these stomach pains that you've had for years and years.
Yeah.
Your mum used to drink lots of Gaviscon.
Yeah.
You used lots of Gaviscon. You, at one point, had a peptic ulcer.
Yeah.
You said that on the tablets I gave you, the stomach pains got better, but you still get them.
Yeah. Now, it's whether it's to do with the tablets, I don't know. It's whether I might have eaten something or eaten too much and pain don't initially come around and then all of a sudden it appears. It could be that, I don't know. But sometimes they're excruciating, if that's the word.
Where in your tummy do you feel it?
But round this way.
In the middle?
Mostly, yeah, mostly. But sometimes it's been to the sides, you know. It just depends, I don't know. They just come and go. I can eat a horse and feel all right. I can eat half an horse.
Do you get any other stomach symptoms? Burping, bloating, reflux, swallowing problems?
I have trouble sort of yawning sometimes because as I try to yawn, it's lifting this pain up a bit further.
Yeah.
Then I've got to wait for a gap. I wait for an opening to yawn. I think, right, now there's a gap here. I will go through it. So, you know, then I'm sort of like...
Having a good yawn?
I'm having a very good yawn. I'm making up for like the last 4 in one go.
Okay.
You know, with the last 4 average yawns. I've had 5 yawns in one. That's the way of putting it.
I think you've explained that very clearly, which is good.
I'm not a big meat eater. If I've left to my own devices, I would tend to eat a lot of beanie type things.
Okay.
I tried a very tentative with egg.
Yeah.
And she had a rash, but mainly around her mouth, and she also would vomit.
I don't eat any butter at all, apart from on toast, which is about once a week. I do eat cheese, but not tons of it. I stopped eating bacon because of this.
Do you like your milk more than your food at the moment, young man? Is that the problem?
So you thought you had put on weight, so you stopped eating potatoes.
Yeah, and just stop eating a lot of potatoes and starch was not the thing to do. You know?
Oh, right, okay.
But I possibly went too far down that road.
And we'd spoken before about the fact that your diet was quite restricted.
Well, yeah, I very seldom eat cooked foods. You know,
it's mostly
or even
cereal.
Microwave. Yeah, it's mostly cereal. Although, just recently I bought a couple of ready meals and I buy some what they call hot chicken nuggets. I eat like say 30 of them in one go.
That's quite a lot.
Yeah, but they're only like that. It's like eating I don't know, like I mean if it was like 30 gobstoppers.
When you've eaten 30 of these things, when you eat 30 of these chicken nugget things, does that give you this stomach pain?
No.
Okay. Thinking about all these things, you've never had any bleeding, you've not got any swallowing problems, and your weight has been extremely stable. So that's good.
Yeah. You know, so I don't eat a lot. Oh, I drink now and again. I eat the beer quite a bit, but...
What's quite a bit? Because whenever I've asked you about alcohol in the past, you've said that it's very unpredictable. So if you've got some money, you might buy some cans and then
yeah,
drink.
the cans are ongoing, right? But the thing is, going out for a session is basically once every week.
How many beers will you have on the day that you get paid?
Oh, Christ. I don't know how many I've had. I don't count them.
So you might have 10 pints that day,
no,
15 pints?
I'd go more than 10, but I wouldn't say... I couldn't give you an exact figure after 10.
Does that make your stomach pain really bad?
No.
Okay.
I don't think it does anyway. I've never actually it's never occurred to me that could be it, but might well be.
Let's draw this to a close. I guess the question that's been going through my mind is, do we need to send you back to the stomach doctors, given that you've got ongoing, sometimes very severe stomach pain that hasn't gone away with the tablets I've given you, and we don't know what the cause is?
Right.
What's your feeling about that?
I don't mind.
I think you need one more blood count, because your last one was ever so slightly low, and it changes the decision if it looks like your blood count is dropping.
Right.
So have your bloods done. Right. Come and see me in 3 weeks' time.
I should have the blood test in 3 weeks' time.
Good to see you.
Yeah, and you.
Take it easy.
Yeah. Right, we'll find your way out again.
Yes. Left at the end.
The lungs seem to be working, don't they?
Hiya, I've just lost Lily. I think she might have gone to the toilet.
Okay.
So she said, fine. I have a look because she's just been taking her weight and all things, preparing stuff.
Hi, Mike. My name's Sean.
I thought I've lost you forever.
Brenda.
I broke my leg. No, that's
all right.
Okay, Lily, sit down nice and quietly. School and nurse noticed the differences in Lily.
Okay.
And they sent me to see you about her nosebleeds.
Right.
They're very violent and very often.
Oh, honey, just be careful there, because I don't want you to go too high and then fall off, OK? Let's bring you back down a little bit.
She's a very active little girl.
OK, and nosebleeds, how often does she get those?
She had one yesterday. It wasn't that bad. How often? It's not regular, but...
Like once a week, or...?
It would be like a couple of times a week, and then it will stop for a week or two.
Yeah.
There was a month break, but when they come in a series. Like, there's more of them.
Can I have a little look in your nose? Is that OK?
Yeah.
Yeah? So, what's the longest without a nosebleed? A few weeks?
A month,
maybe?
It was, I think, a month.
And when she's having a run, how often does she get them? Every day, or...?
It will be every day and a couple of times a day.
And what do you do when she gets a nosebleed?
What we do is, I've researched to hold the tip of the nose.
Absolutely, yeah, that's right.
Do not lie her down.
How long does it take to stop bleeding?
10 minutes, that's the minimum. They're very violent. There's lots of blood coming, sudden, like boom, and a big rush.
There is a peak in the incidence of nosebleeds from the ages of 2 to 10, and then in the older age range of 50 to 80.
Just relax your nose. Don't scrunch it. Relax.
Is it going to hurt?
No, it's not going to hurt.
I wasn't 100% sure on what was causing Lily's nosebleeds. It might be because there is prominent vessels in that part of the nose. Also, there was some crusting to the nose, and certainly an infection can cause nosebleeds, and it's always worthwhile treating.
What we're going to do is I'm going to give your mum some special cream that I want you to put on the inside of her nose, OK? 4 times a day for 10 days.
10 days?
Hopefully that
Thank
will
you.
stop the nosebleeds.
Be sad. 94649.
Smile. We're happy. All right, there we go.
Lila, you've got
Okay.
to stop. You've got to stop now.
All
Okay,
right.
thank you very much.
Bye-bye.
If you feel he needs to be seen, I can ask the on-call doctor to call you.
No, you're full of stress.
Wouldn't you be stressed? Can you put yourself in my situation?
I know. I know.
Instead of ganging up on me?
We don't gang up on you.
You did.
We just want to help you.
Even
Take
Chelsea,
this-
Chelsea brought
Take the stress off.
Come in.
Pleased to meet you, mate.
Hello. Please do
Hello.
all have a seat.
I'm from Australia.
Are you?
I'm over for about 3 months.
Great.
Recently retired from work.
Oh, congratulations.
Well, I've done my bit.
Yeah. What job did you do?
I work for council in Sydney.
In Australia?
In Sydney.
But you're from the UK originally?
Sheffield.
Sheffield.
Yeah, you can't take his way, can you?
You can't. What can we do for you
Well,
today?
what happened is me looking after myself since I've retired. Go to the gym 3 times a week.
Yeah.
Swim, do my 30 laps after day for an hour in the gym.
Well done.
Yeah, exactly. I'm feeling good, lost a bit of weight, looking after myself.
Brilliant.
Started getting floaters and flashes.
Oh dear.
Exactly. So straight away I went to Sydney Eye Hospital.
Well done.
There's no detachment, but he says it's important that you have a follow-up in 6 to 8 weeks.
So we've got to try and arrange a way for you to see an eye doctor
That's right.
to have another examination.
That's right.
There we are. Well, we can
Slot
sort that
in around
out.
about 6 weeks.
I can sort that out for you.
I've not slept for 2 days, so I think that can probably affect this. I don't know, can they cure floaters?
No.
Kind of thing now, instead of turning my head suddenly, I might get a little arc, like flash. But I've got a floater there now, but I'm kind of learning how to put up with this.
Yes. Floaters are shadows which are cast on the retina by debris which is inside the eyeball. The retina is the thin lining at the back of the eye which detects light. That's what you use to see. In most cases, floaters themselves don't need specific treatment. What I'd like you to do is, on the way out, if you hand this to reception so they can photocopy it,
That's fine.
and I'll send this off with the referral.
Yeah.
If we're not able to get that organised routinely, we can get you seen in the emergency eye clinic.
Oh, that's fantastic. Oh, that's good.
So that's easy to sort out.
Thank you for your service.
Nice to see you.
Much appreciated, and thank you very much.
I don't know what's causing it, but essentially my mouth is very sweet.
Very sweet.
Yeah, it tastes like I've always got sugar in my mouth.
I have to say it's a completely new one for me. I've never heard anyone say that before.
I couldn't feel anything here and here. It's like when I had anesthetic.
Do you have swelling on your tongue as well, or just the mouth?
Not the tongue, just the
And your
mouth.
breathing was okay?
Well, okay.
Okay.
Every night this week, nothing, except for last night.
All right.
It started again last night. I thought, well, what's going on there?
Feels like something's going to pop out of my ear.
Okay, nice.
You have your tea, you're not drinking your tea.
Coffee it is.
Yes, coffee. I drink tea just like that.
Black.
Yes.
Right then.
I never had this before.
Right.
I went to bed Monday night.
Yes.
When I wake up to spend a penny, my whole body was in pain. All my back just hurting. I was in a terrible state.
Oh gosh.
What do you think caused that?
Not sure. I need to ask you more about it, then we'll decide. So, do you have a headache?
Yesterday, I was having like a headache.
Right.
I don't have it today.
Where does it hurt today? Both knees,
Both knees and
elbows.
elbow. And when I do like that, when you do like that, and when
What do you mean?
when I breathe in, you could feel a pain around here and all that.
Right. Is your vision normal?
Yes, vision. You know, sometimes I get the vision sometimes it's like, you know, the light, not this kind of light, like the bulb.
Yeah.
The bulb like a zigzag, but it
A halo.
what is it? No, no, halo is round.
Oh.
This is not a round. It's like a zigzag.
Okay. So can I have a look at your shoulders, maybe?
Yeah.
Can you maybe
Take-
slip this
take
off?
this off.
Have you got a T-shirt on?
No, I don't wear I can't wear up clothes.
Okay.
Yeah.
So let's just check up here. Are you tender around here?
No, it's all right when you touch it.
That feels all right?
Yeah.
Fine. Let's just work around your shoulder joint, okay? Okay.
Yeah, yes, when you press
At the back?
right there, sir. Right
Okay. Can you stand up for me? Okay.
there. Yeah.
Perhaps if you have a seat.
On the bed,
Yeah, just sit on the edge for me.
like somebody was bashing me. Oh,
All right. Can you put both hands behind your head for me?
yeah.
Can you push your elbows back? Does that hurt?
A little, not much. A little.
Can you put your hands behind your back as though you're doing your bra?
I can't do my bra that way. I have to do it in the front and then turn it. Yeah.
So can you show me your knees? So which knee's worse?
This one.
And where does it hurt?
This, you see, oh, this one's there.
Let me just work around your knee. Does it hurt on this
And your
side?
hand cool.
They are cold, aren't they?
Yeah. Oh, it's so cool. Feel my arm.
Oh, yeah, your hands are much warmer.
Yeah. Yeah, you see.
Oh, you've got a little...
What? A cyst?
Yeah, a little bit. Can you bend your knee for me up and down?
I exercise it. I try and exercise it every day.
All right.
Why I wake up with this pain?
I'm Paul, the healthcare assistant here. Come for your blood test.
Oh my God. Is this your natural hair or is this artificial hair?
Yeah, natural hair.
Sorry, it's squirted. It's definitely a cyst from the fact that it's squirting everywhere.
I've done blood tests quite a few times and it's quite difficult to
Really?
find out, yeah.
I like a challenge. Yeah, got it.
You can have the record for most wax down your ear. My God. Yeah.
Come through. All right, I'm Karen.
Thank you. Sorry.
Sit here for me.
Yeah,
Lovely.
exactly.
Okay, so you come to see me today about smoking, is that right?
Yeah.
You want to give up, do you?
Well, I'd like to. I'm 75. I've been smoking, just to fill you in, since 1954.
Right.
So it's going to be a long, hard job. I'll cut it down to 4 a day.
So why all of a sudden you decide you're going to stop smoking?
Well, because I've had a bit of trouble in as much that I've started falling over.
Okay.
And I think that it's down to...
So you've never given up smoking before then?
No, no.
You ever tried the inhalator or the you know, the electronic cigarettes? No.
Well, the flavour is disgusting. It's not tobacco, that's for sure.
Well, no, it's not. That's the idea of it. You're addicted to the nicotine, but the thing that's killing you is the tobacco itself. So there's obviously things I can give you to help you to stop smoking, like patches. And obviously there's oral products as well you can use, chewing gum, lozenge.
That interests me, chewing gum.
Chewing gum, because you can't get rid of the last 4 cigarettes, I think you probably may need a small patch.
Well, probably, yeah.
You're going to give it a go?
Oh, certainly.
OK, I'm just going to go get my machine to take a carbon monoxide reading. 1 minute.
Okay, yeah.
Paul, have you got your machine?
Yeah.
Could you do it for me? Yeah. Thank you, sorry. I've got my colleague with me because his machine's working and mine's not.
How are you?
So this is Mr. Durnsford.
So in a second, I'm going to get you to take a deep breath, like that, and hold it in. And then on the 3rd beep, you blow out through the tube slowly. Just release it like that. Okay, take a deep breath. Hold it in. Hold it. Hold it, hold it, hold it. And the 3rd beep. So now blow out slowly. Until you can't blow anymore. If you
That's
stop,
it.
that's fine.
Lovely, thank you. All right, that machine's telling us that your oxygen loss level is 2.4%. So that means your vital organs, liver, lungs, kidney, especially your heart, is working 2.5 times harder to keep you alive.
Oh, God.
It should be naught.
Should be.
Yeah, it should be naught. Yeah. So the plan of action will be, I'm going to give you some low-dose patches. The patches are used 1 a day, and I'm also going to give you some chewing gum. You can have that as and when you need it.
That gum.
Yeah.
Will it increase my CO2 emission?
No, it's going to release it. Because if you stop smoking, that's what the idea of this is about.
Oh, right.
If you'd like to come to the waiting room, I'll bring you the prescriptions to you. Come on, then.
Come and have a seat over here again.
What's your name?
Dr. Pierce.
Pierce.
Yeah.
Pierce. Oh, I used to work with a lady named Mrs. Pierce.
We have met before. I think you had a chest problem then.
Oh, when I have that, oh, God, sorry. Jesus.
Right. I'm not absolutely sure why you feel like this. I think that there are some things that we should rule out.
What, like what?
I want to rule out a problem called polymyalgia.
What is that?
It's a muscle inflammation problem.
Because somebody was saying to me I could be having inflammation.
Polymyalgia is a syndrome causing muscular pain and stiffness, which quite often comes on relatively suddenly and usually affects muscles in the upper body, around the shoulders. It can make people feel quite ill and tired. It more commonly affects women and only really affects people over the age of 50. So I think the way to do that is with a blood test today. Yeah. Maybe we should see you again tomorrow with the results.
Tomorrow, Friday. So I have to come or kind of phone or so.
We could phone. I'll leave it on the list for somebody to look at the results tomorrow and ring you.
What time? Oh, they would ring me.
I'll ask them to ring you and tell you whether or not you need to start some steroid tablets.
Oh, God.
Whenever we talk about polymyalgia, we also give people the same advice. If you were to suddenly develop a very severe headache or have any funny changes in your vision, you need to tell us immediately.
Okay.
I don't think that'll happen, but we always say the same thing.
Yes. Well, it's nice of you to give me all these instructions. Doctor, you married?
I am married, yes.
You have children?
I do, yes.
How many?
I've only got one.
Only one? Oh, how old is she?
8 months.
Oh, it's a baby. A girl.
A girl.
What's her name?
Isabel.
Isabel. Oh, dear.
So, take these round to room 1.
Yeah, room 1. Hold this for me, please. I can get them. So when you get old, you know, all kind of things. You want to get old?
Not really.
Anyway, I'll see you and thank you.
All right.
Yeah. Bye.
Bye-bye.
Thank you. Thank you very much.
Pleasure. I hope you feel better soon.
Okay, thank you.
Okay, wonderful stuff. Take care.
Thank you. Nice to see you. Bye-bye.
Bye-bye.
Would you say thank you to the doctor?
You're welcome. Are you going to let your mum put the cream on so it gets better? You're welcome.
Brilliant.
Right.
Thank you very much for that.
Okay,
That's great.
nice to see you.
Nice to see you.
Bye-bye.
Thank you.
Bye, thank you.